Hi, it's Dr. Daniel Hockenbury here over at Ried Physical Therapy. Today we're going to be going over some frequently asked questions we get regarding the neck. One of them is that I have this pain in the back of my head. It actually radiates up the back. It's often after I'm done working. What's kind of causing that? So what's actually happening here is especially in this region, we have the small area here on the back of our head known as our suboccipital region. That's below our occiput, which is this top bone on the back of our head. So what actually is happening here is some of the muscles here on the back of our neck, or some stiffness here in the upper parts of the joints in the upper part of our neck, are actually tight and restrictive. So what's happening here is that this area is not moving as efficiently, or we have some muscle restriction in that area, leading to some of those nerves that actually protrude out of this area that radiate up the head. We're actually leading to some compression through those. So with that compressive force, what actually can happen is it can give us that radiating pain that kind of seems like it comes up either the side of our head, over the top of our head, sometimes out into our eye. And what actually has to happen here is we have to open up that space there in the back of the neck. So doing strategies to actually stretch the muscle tissue or work the joint if it feels like the joint itself isn't moving as efficiently, to allow for that space to not have the muscles compressing down. We actually have to go ahead and work on both components of the joint and the muscle to be able to get that to open up, so it actually leads to less compressive forces through there. Most commonly, this happens with individuals who are sitting at a desk while they're working, whether they work from home or they work in the office for long hours. But usually it seems to be in the evening that starts to come out as individuals start to get more and more forward. We get more and more compression through there. But very, very treatable area. It actually is very much those things we can teach the patient to be able to pull their head back, get their posturing back, to open up that space to allow for less compression through there, and make it a little more comfortable for them daily.